Today, we're diving into something you may have seen buzzing online, a so-called magic nasal spray that claims to reverse erectile dysfunction, boost libido, and give you erections so strong they rival those you had in your 20s. Hi, I'm Dr. Emma Blake, urology and men's health expert. It's called PT-141, also known as Bremelanotide, and I'm going to walk you through exactly what it is, how it works, and whether it's actually worth trying. And yes, I'll explain why some men call it their sex drive switch. But first, let's clear something up. PT-141 is not a new version of Viagra or Cialis. Those medications work by increasing blood flow. PT-141 works in a completely different way, and that's what makes it so unique. Let's start with the basics. PT-141 is a peptide, a small chain of amino acids, that was originally developed to help with skin pigmentation. But during early studies, researchers noticed something unexpected. The male patients in the trials began developing spontaneous erections, even without sexual stimulation. This led researchers to investigate PT-141's effects on sexual function, and what they found was fascinating. Instead of working on the blood vessels like Viagra, PT-141 targets the nervous system, specifically a part of your brain called the hypothalamus, which regulates sexual desire and arousal. In simple terms, it doesn't just help you function, it helps you want to function. Now here's where the science gets interesting. PT-141 is a melanocortin receptor agonist, meaning it activates a family of receptors in the brain linked to appetite, motivation, and sexual behavior. This makes it effective even in men who don't respond to traditional ED medications. In fact, several clinical studies have shown that men with psychological ED, diabetes-related ED, or low libido may see significant improvement with PT-141. And for men who already use medications like tadalafil or sildenafil, PT-141 may enhance the psychological and arousal side of the experience, not just the mechanical part. So what form does it come in? Here's where things often get misunderstood. The only FDA-approved version of PT-141 is an injectable approved for women with low sexual desire. The nasal spray version, which is often sold online or through some clinics, is not FDA-approved. It was used in early trials, but raised some safety concerns, like blood pressure changes and nausea, which limited its approval for mainstream use. So while the injectable form has solid clinical backing, the nasal spray is considered off-label and less commonly prescribed. That doesn't mean it's always dangerous, but it does mean you should be cautious and work with a qualified medical provider who understands dosing and risk factors. Now let's talk about real-world results. In trials, men taking PT-141 reported increased libido, more frequent spontaneous erections, greater mental arousal, and in many cases, improved confidence and performance in the bedroom. However, it's not perfect. The most common side effects include nausea, flushing, and headache. Some men also reported fatigue or increased blood pressure. This is why you should never try peptides like this without proper medical supervision. Just because it's natural or bioidentical doesn't mean it's risk-free. Now let's slow down and go deeper for a few minutes, because this is where a lot of men get confused. Here's what I want you to understand. PT-141 works upstream. It acts on the desire pathways in your brain, not on the penis directly. So if your ED is primarily blood flow related, like from poor circulation, high blood pressure, or diabetes, PT-141 might not be your first-line solution. But if your issue is more related to stress, nerve signaling, porn-induced arousal dysfunction, or simply lack of desire, PT-141 may help reset the brain's connection to physical response, which is incredibly valuable. It's like reawakening the arousal center, not just flipping on a blood flow switch. Now, a lot of men ask me, can I use PT-141 with Viagra or Cialis? The answer is yes. In many cases, it's used in combination. PT-141 enhances desire and mental arousal, while Viagra or Cialis supports the vascular response. This combination can be especially useful for men with mixed ED, meaning they have both physical and psychological contributors. But again, only combine treatments under guidance from a licensed provider. Let me give you a real-world example. One of my patients, a 56-year-old man with type 2 diabetes, had been using sildenafil for years. It helped, but the results were inconsistent. He said, "Sometimes I just don't feel in the mood, even if my body is working." We introduced low-dose PT-141 injections once a week, alongside his regular medication. Within 2 weeks, his desire came back. Not only was his performance more reliable, he actually looked forward to intimacy again. That's the power of combining mind and body treatments. Now, let me answer 2 final questions I hear all the time. Can I buy PT-141 online? Technically, yes, but most of what's sold online is unregulated. Some products are mislabeled, underdosed, or contaminated. Only purchase from a pharmacy under medical supervision. What about the cost? PT-141 is not cheap. Injections can cost $30–$80 per dose, depending on the provider. The nasal sprays, while less expensive, may not be as reliable or safe. So what's the bottom line? PT-141 is a powerful tool, especially for men with low libido, psychological ED, or who don't respond well to PDE5 inhibitors like Viagra. But it's not a magic fix, and it's not for everyone. If you're curious about trying PT-141, I recommend starting with a full evaluation from a provider who specializes in men's sexual health. Understand your root cause, and from there, build the right protocol for your body and goals. And if you're not quite ready for injections, I want to leave you with something simpler. There's a natural, safe way to support your erections and stamina, and that's by increasing nitric oxide levels in your body. One of the best ways to do that is with watermelon extract, a supplement rich in L-citrulline, which helps increase blood flow and support erectile function. I recommend this to my patients all the time as a first-line support, especially when they're not ready for medication or injections. If you want to try it yourself, I've linked a trusted supplement in the description and pinned comment. It's affordable, clinically dosed, and easy to use. No needles, no prescriptions. I'm Dr. Emma Blake, and whether you're trying peptides, supplements, or just taking your first step toward better health, remember, your sexual wellness is worth prioritizing. Don't suffer in silence. The right solution is out there, and I'm here to help you find it. Thanks for watching, and I'll see you in the next video.